and MS University, India, and taught various computer science courses such as system simulation, data science to both UG and PG graduates. He has spent his career working on product engineering and led teams to develop healthcare products like Lorenzo, and contributed to NG program delivery at National Health Services NHS UK. He has done Masters in Computer Science from BITS Pilani, MBA from Brigham University, and doctorate at SRM University. It's indeed a pleasure to welcome you, sir. HOD ma'am, would you like to add a few words?
Yes, sir. So on behalf of AVIT Management and Department of EC and Biomedical Engineering, it is my privilege to welcome my friend, childhood friend, I have to say, Dr. Raj Vaithamanidhi, who joined with me, with us to share the knowledge about digital transformations in healthcare industry. So he is having a good expertise in computer science engineering, then management, and also he is exclusively working in healthcare sector. So he is in our midst to share the knowledge about the domain he is working with us, the technology of the day today, what we are expecting. So welcome Mr. Dr. Raj Vaithamanidhi to the session. Thank you. Thank you. You can kindly unmute yourself.
Yeah.
Your voice
Okay.
is not. Yeah.
Okay. I think you guys can hear me now.
Yeah.
Okay. Thanks for inviting me to give a keynote address in the AVIT conference. I would like to thank Hema for giving me this opportunity, and also for the participants. And I'm glad that such sort of conferences is happening in India, and you guys are joining on a weekend, particularly on a Saturday morning, to understand and to hear from the various people. And I was also listening to Mr. Nandakumar, who was giving a talk about robotic enabled healthcare. So it's a great opportunity for you all for attending these kind of sessions and also learning from the experts. Okay, I will share my screen and give my presentation. Give me a sec. Okay, hope you all can see the presentation. Can
Yes,
everyone
yeah.
see it? Okay,
Yeah.
thank you.
It's visible.
Okay. I will give you, rather than saying a lecture, I will share my thoughts and my experience on the healthcare digital transformation, and also about the emerging trends, and what are the key activities happening across the globe, and what kind of things are happening, and what are the areas we have to focus on, and the things will help us to enable the way the healthcare will transform in the coming years. So we have seen during the COVID how the health and the technology has been a catalyst, mainly in the way we all work. And I know in India, as like across the globe, people have been using mobile devices to order the products online, and also to carry out their banking transactions online. So that means we don't need to travel, or we don't need to take time out to carry out some regular routine activities. So all of these can be carried out in online. So however, it has been a challenge, particularly in the healthcare sector, in adopting the clinical systems and in adopting the technology, because always it's all about safer, and it's all about making sure that the patient care has been maintained, and there it will not create, because we are not playing. Okay, even when you are going to do the transactions in the financial banking, online financial banking activities, at that time also the risk is involved, but at least the risk is associated with the money. And so you can try to be careful as much as you can, and you can take some necessary precautions But whenever you are going to use technology or the clinical systems and to provide care to the patients, always clinicians will be doubly, triply cautious, and they don't want to use the systems if they think the system is not safer enough. So that was one of the main reason, and the technology adoption in the healthcare system has been lagging behind compared to the other industry and other sectors. However, in the developed countries like United States and United Kingdom and Australia and other European countries, there has been a lot of changes has been happening, and that systems, clinical systems have been used compared to the developing countries like India and any other countries. Even then, the software has been developed by the Indians across the globe. So in India, okay, still we are not at in the stage of adopting the clinical systems. So I'm glad to see that, okay, a lot of companies are now coming out, and the people like Nanda Kumar are taking, I'm glad to see that he's taking that venture and willing to come up with these robotics systems, which enables the organizations to provide the surgical care to the patients. So, but the COVID-19 has changed the way, okay, it has been working, and it helped the people to embrace, use, and build the trust in the way we all work. And digital health is playing the key role in improving the connected care and helping people to be safe during this time. Okay, healthcare digital transformation means it is not only about leveraging the techniques. It's not only about using the clinical systems in providing the care. It's all about it's all about the introducing the change management process and adopting the change management process that closes the gap between the demand and the supply and enable better patient-centered care. As you can see, okay, people are at home and in the community, and nowadays the governments and organizations wants to keep people at home as much as possible, because always there is a shortage in the healthcare organization, shortage in the beds, and a shortage in the resources. Everywhere it is a problem, particularly during this COVID time. We all seeing that. Okay, so that is a challenge. So that's why organizations and the government are taking the steps to make sure that people are healthy and people are being fit and getting the care in the community where they live, rather than they come to the hospital. It's always the organization's intention is to maintain and reduce the number of people who are being admitted to the hospital, reduce the number of people who are being calling the ambulance services as much as they can. So then that will give a lot more capacity, and it will enable them to provide better and safer care to the patients. So that's why if you look at in any country or in any organizations, they are working at 3 levels mainly. So people are being in the community, and they are accessing the primary care centers, or they are accessing the clinics. In India, you call it as a clinic. When you are not well, you go to the clinician who you well know, or who is providing a specialty care in the particular area, or who are attached with the hospital and providing outpatient service, and you will see them. That is called primary care. In UK, that kind of primary care is being provided by a general practitioner, and it is a separate entity and a separate organization. They are being governed by a different clinical groups. So once the patients are being assessed and triaged, the general practitioners decide, or in India, the clinicians decide, okay, whether that patient has to be admitted to the hospital or whether they need a surgery. Then they will refer that patient to a particular hospital, and then the patient will go to the either A&E or go to that particular referral area, and then reviewed by the nurses nurses and then by the clinicians, and then they will be admitted to the hospital. In a similar way, in UK, the patients can go to the A&E, accident and emergency area, whenever they are in an emergency situation, or they can call ambulance to visit the hospitals as an emergency, or otherwise they have to be referred by a general practitioner who works in the primary care, and then they will be referred to a district general hospital. Once the patients are referred, then they will be the referral will be assessed and reviewed and triaged by the consultant and the registrar, and then they will decide whether to see the patient and whether to ask the patient to come for another outpatient clinic before they are given permission for the patient to admit to the hospital, or whether the patient need a surgery. They will take that kind of decision. Then based on that, the care will be provided. So even in UK and in all other developed countries, still papers are being used and papers are being maintained when providing the care. So there is lots and lots of medical records. Organizations are having a problem, and that's why they are introducing a document scanning centers and OCM, and they scan the documents and make sure that the documents are available for the clinicians to review the historical records when and where it is required. So it is more and more critical and necessary to make sure that healthcare services are transformed, and the better, safer, and easier care can be provided to the patients at the right time, at the right place, and by the right consultant. So it's all centered around the patient, as we have discussed and I explained so far. So the patient care is being provided by the different set of healthcare providers, and they are being provided either in the primary care settings or in the secondary care settings or in the tertiary care settings. So if the particular facility does not exist in the district general hospital, then the district general hospital or the local, just like that, a small hospital in Chengalpattu might transfer the patient to a bigger hospital like Madras Medical College in Madras or Stanley Medical College. Then the patient will be treated by a specialist, a consultant. At the same time, in India, most of these healthcare services are being provided by, the payment to these healthcare services are being provided by the insurance companies, unless otherwise we go to the government hospitals. But nowadays, most of the middle class and even lower middle class people and upper middle class people will prefer to go to the hospital, and everybody are having the insurance, and the government has taken and introduced a lot of insurance policies. So there is a role of the healthcare payers, and they focus mainly on the way the policies are being provided to the patients, and the care and the appropriate care can be provided to the patients based on the policies. In addition to that, every country has their own regulators, and Nanda Kumar mentioned about FDA. So it is a regulatory organization in USA, and it is their responsibility to ensure that the clinical systems or the medical devices which are being used in the healthcare used by the healthcare organizations to provide a various care are being regulated, and the medical devices and the clinical systems are very safe. So that's why they have introduced a lot of clinical safety processes in place, and based on that clinical safety process, it is the responsibility of both the manufacturers and the responsibility of the organizations which are deploying the systems into the organizations to ensure that the system is safe. So if the clinicians think a system is not safe, then they shouldn't roll out and they shouldn't deploy the systems in that organization. So that's why in each and every organizations, they now the organizations have taken the steps to introduce the role called CCIO, Chief Clinical Information Officer. You might have heard about clinical information of, Chief Information Officer as like CEO, but the CIO focus on the information and technology area. But nowadays, all the healthcare organizations are introducing the roles called Chief Clinical Information Officer, that is mainly led by the doctors and the pharmaceutical peoples. And in a similar way, the organizations have introduced another role called Chief Nurse Information Officers. Okay, they are mainly represented by the nurses, because the clinical information systems are mainly used by the doctors and the nurses in providing a care to the patients. So, and the NHS Digital in UK, there is a organization called NHSX, and they have set up another length arm organization called NHS Digital. So it is their responsibility to ensure that these kind of regulations and policies and processes are in place, and those policies and processes are adopted by each organizations, and each organization's board, the trust board, responsibility and accountability to ensure that, okay, those roles are appointed and those systems are being in place. So they will also be audited by the organization called CQC, and based on their various assessments and various audit activities, they will rate the organization as a good, it is a good organization to take a care, or it is an outstanding organization, or it needs improvement. So it is not, it is based on the way they provide the care, and the way the quality care is being provided, and whether it is safer, whether the people are being trained, and whether all the clinical processes are being followed, and the incidents are being reported. So they will assess and monitor each and every parameters. So it is the responsibility of each organizations and board members to ensure that such roles are in place and such processes are in place. When I mentioned that the clinical safety report has to be produced both by the vendors and both by the organization, mainly two reports. One is called DCB 129, DCB 0129. You can Google it and find out further detail. And similarly, DCB 0160. DCB 0129 is the report which has to be generated by the manufacturer or the vendor who provides that clinical systems. And similarly, the clinical safety case report DCB 160 has to be prepared and presented to the board, to the project board, and make sure that and inform that okay, the system is safe and it can be rolled out. So they the CCIO and CNIO refer back to the DCB 129 and review the clinical hazards, and based on that clinical hazards, they will decide whether is it safe. If it is, if the clinical hazard score is greater than 3, then they will say, yeah, system can be rolled out, but some adequate action has to be taken and in place, and then appropriate resolution has to be provided by the vendors at the right time as soon as possible. If the clinical hazard score is 4 or 5, the system cannot be rolled out. And if it is less than 2 or 1, then it is okay to be rolled out. So those kind of conditions are in place. Unfortunately, in India, okay, it will take time. At the moment, those kind of checks and processes are not in place. Clinical systems are being introduced, and clinical systems are being used in various healthcare organizations like Global Hospital or Apollo Hospitals, or in any other organizations. But the system is being tested by the testers or by the or people who is going to use the system, but this kind of detailed clinical hazard review is not taken, or is not being tested to an extent it has to be done. But I'm hoping and confident that those changes will come to India also at some point, and much more further detailed checks will be carried out, and further checks will be introduced to the vendors. that will enable, and it will enable the vendors to provide the safer systems, and it will give assurance to the patients and the clinicians that they are using the right system while providing the care. So why the digital transformation is required? It is, I already told, it's not only about the technology, it's mainly about the change management process. Change management process means, okay, it's all about what are the current process and what are the future process, and how the process is changed when the system is going to be introduced, what sort of process will be changed and what sort of impact it will have, and how it has to, what sort of actions has to be taken. For example, okay, the system detailed testing, system integration testing has to be carried out, user acceptance testing has to be carried out, clinical safety case report has to be prepared, and the training has to be given to the users. So these are all some of the activities, and you also have to create awareness of the issues or the challenges they might face in using the system. So digital transformation is relevant to both the scholars and the practitioners in the field. Why it is needed? Because we all know population has been increasing, and the people's age is also increasing, and there is a lot of people are living for a longer time period. That is good news. Okay, we all can live with our parents, and as you can see, over 100 million Europeans were greater than or living beyond the age of 65. So that means there will be more and more pressure on the healthcare organizations. So increase in the incidence of life cycle related diseases, our life cycle and behavior is also changed. So because of that, okay, we are also incurring a lot of diseases. We are not doing exercise, and we are getting obese, and we are getting diabetes. So people are living with more than one chronic disease. And when friends meet, they all talk about their chronic disease, definitely if they cross the age of 45 or more than that. And decrease in the, I already mentioned about the demand in the number of hospital beds. We can see that during the COVID, there is a decrease in the number of hospital beds, and people have been struggling to find the beds. So shortage of healthcare workers and the clinical resources are burning out. So that's why it is important for us to behave safely and to make sure that we all maintain the social distance, we wear the mask, and we shouldn't travel out as much as possible, and we have to use the hand sanitizer on a regular basis. So that will help the clinicians to provide a better care to the people who they need. And the global per capita spending is less. And the another interesting factor is rising of literacy. The focus is shifting from healthcare, which is provided by the clinicians. Now the care is being provided based on the needs of the patient. It's all about patient's health and well-being. So there will be greater focus on promoting healthy lifestyles, vitality, and wellness, and try to keep the people at in the community and in the primary care centers, rather than letting them to come to the secondary care hospitals. So it is important to prevent and the patients getting admitted to the hospital as much as possible. That's where the early diagnosis is required. Last but not least, always organizations and people are struggling to maintain financial sustainability, and there is uncertain during this uncertain and changing environment. In 2018-19, NHS hospital has a deficit of around 551 million. Okay, there are lots and lots of factors, but the underlying factor is organizations are facing the budget problems. That means they couldn't be able to provide the right care to the patients. I have to tell you one thing: in UK, the basic care which is being provided to the patient is free. That means when you are in emergency And when you are referred by the GP, you don't need to pay anything and you will get a better care. It is like in India, when you go to the government hospital, you get a free care and you don't need to pay anything. It is similar to that. And I would say 90% of the people go to the NHS hospital or to the government hospital rather than go to the private hospital. Only 10% of people go to private hospital. But in India, unfortunately, we adopt the American systems, and 90% of the population goes to the private hospitals, and only 10 to 20% of the people, the poor people, go to the government hospital. In China, and the medical insurance funds expenditure growth exceeded the income growth, and they are also burdened by the country's slowing economy. In Germany, then the hospitals are under the financial distress, and they have submitted the insolvency, and the cases have been increasing in the last couple of years. The main reason is they are seeing the decline in the inpatient cases, because the organization and government wanted to keep the patients in the primary care settings. So similarly, in the Netherlands, the profit margin has declined, and in US, they are also having problems, and their operating margin is degraded further. So these are all the main reasons which adds up to the or which is the catalyst for the digital transformation. I don't need to mention or talk about this much. Okay, we all know what are the benefits of digital transformation in any industry. Okay, it empowers the people, and in this case, it empowers the patients. Patients can monitor and they can manage their health on their own. So patient experience will be improved. It enables them to get more personalized care, and they can get the care on time without leaving the home. And clinician perspective, they can make sure that they are getting the required support from the clinical decisions and support tools based on the thanks to AI, and I will talk about it very briefly later. And then it's all about enable them to provide better and safer care. And it also simplify the way the documentation is being maintained, and gives them satisfaction. And from the organization perspective, it helps them to reduce the length of stay, and it also helps them to reduce the hospital acquired infection. It enables them to provide an integrated care by introducing the integrated care pathway. By introducing the new set of models, and to provide a value added care to the patients. So what's the current state in the organizations in the way the care has been provided? So if you are familiar to the healthcare industry, and you might have definitely heard about these two words, enterprise systems and best of breed systems. Okay, there are some companies which provide the enterprise systems, which are very popular in US, or Cerner and Epic. So these two are the popular system, and another one is Allscript, and another one is Lorenzo. So different vendors have developed this electronic patient record or electronic health records. You might have heard EHR or EPR. So this is the enterprise system. The problem is it will take a longer time to deploy the system. Even then, that system has been used in the industry for many years. So you have to do a lot of customization and configuration before the system is rolled out. You can roll out various functionalities or modular elements in a phase by phase manner, but even then it will take a longer time, and it is also very expensive. And because you have to enter into another 5 years or 10 years contract with this organization, that means you are tied up with them. If there is a delay in providing the functionalities what that particular healthcare organization wants, then you are stuck with them. It is like a marriage. Okay, once you are entered into that entered into the contract with that particular vendor, and if you started to use that system, you have to at least end up in using that system for the 10 years. If you want to move away from that system, it is going to cost more and more money. Or at the other end, organizations are using best of breed system. That means they are all using patient administration system, which is PAS, okay, which is a familiar name. I'll call it as PAS, which is mainly used to carry out the administration activities about registering the patient and capturing the admission related activities and transferring the patient from one ward to another ward and then discharging the patient. So this is the main system in the hospital. So whenever the patient is admitted into the hospital or registered into the hospital, then all the patient demographic information and any movement, the patient movement within the hospital is captured using that system. So it is the core element or core systems in the clinical sector. Then when the patients are admitted into the are coming to the accident and emergency area, then they use their own system called the emergency department systems. And in a similar way, when you have to raise a request for the blood testing, or if you want to receive the blood results, then you will use a system called order communication. In a similar way, if you want to raise a request for the radiology scan, X-ray, CT scan, or whatever it is, then you have to raise a request, then you have to receive the results, and then you have to view that results. For that, you will use that order communication system. Similarly, to process that blood samples and to send the results, there is a separate systems, and it is called LIMS, laboratory information management systems, or pathology systems, and there are radiology systems and various departmental clinical systems. Within the maternity department, they will use their own system, and in the cardiology department, they will use their own systems, and the theater department, surgical department, they will use their own system to schedule the surgeries and to capture the way the anesthetic information is being has to be provided. And similarly, in the ICU, they will use their own systems. So different systems are being used in the different organizations. Though that's why it is important for the organizations to ensure that the data flows from one system to another systems, and make sure that the information is shared across this organization. All these systems are interfaced. I'm sure you might have heard about HL7. It is all about interfacing one system with the other system and sending the messages and sending the data from one system to another system in a particular format. So and that's where the HL7 messages will be sent out, okay, like EADT messages, admission, discharge, and transfer, EAD01 or EAD03, something like that. I can't remember the exact name. EAD03, I think it is mainly when the patient is getting discharged. That messages will be sent, and when the patient's records are merged, then EAD40 messages will be generated and sent. So all these system interfaces has to be carried out. So that's why it might not be worth enough. Even if you go with the enterprise systems like Cerner, Epic, still organization has to maintain their own pathology system and radiology system. Still they have to develop the interface with this Epic system. So that's why there is a debate and discussion about okay, whether is it better to go for a best of breed, or whether is it better to go for a enterprise system. It is up to each and every individual organization, and based on their clinical strategy, they can make a decision which system they have to decide. In addition to that, when the patient is getting admitted into the hospital, and it is important to monitor the patient's vital signs and make sure that, okay, the patients are in a good condition and their state is, they are not getting deteriorated and they don't need any immediate attention. To monitor the patient's current conditions, in UK, they have introduced a process called NEWS2, National Early Warning Score. So what they will do is they will measure the vital signs like respiratory, pulses, temperature, and alertness. and based on that they will summarize the score. Then based on the score, if the score is less than 3, then they will say, yeah, the news to score is green, and you don't need to worry about that patient. You have to take the next news to score, and you have to take the next set of vital signs after 12 hours or something like that. Until that, you don't need to do any care to the patients. And if the score is greater than 5, or if any one of the parameter score is greater than 3, then they might need immediate attention. And then based on that, either based on the protocols, they have to either call the senior nurse, or they have to call the junior doctor or the senior doctor, or they have to call the immediate outpatient deteriorating team, and then the immediate care has to be provided to that patient as depending on the need of that patient. So for that, the organizations have introduced a system called electronic observation system. The electronic observation system enables the clinicians, particularly the nurses, to capture the vital signs electronically. Previously, they have to capture all this information manually, and they have to do the scoring manually. When they have to provide a care to the patients, it will take a long time to do the scoring. Sometimes they might not do the scoring process correctly, and if the scoring details are entered incorrectly into the charts, then the doctors will look at the chart, and based on that they will provide the care. So those kind of risks are there. So to reduce those kind of adverse reactions and the errors and the incidents, the electronic observation system was introduced, and the system enables the clinicians to capture the vital signs automatically. It can be either entered manually into the system, or this you can connect the temperature monitoring devices or the blood pressure monitors into the patients. Then the system will monitor that the vital signs and send the data automatically into the electronic observation system. Then the chart will be generated, and it can be, and even the messages can be sent to the clinicians based on the organization and the hospital's protocols, and to the junior doctors or to the senior doctors. And instead of sending the pager messages or the bleeps, then the phone messages can be sent out, and the alerts can be sent out to the doctors on their own mobile devices. So then they can monitor the patient. In addition to that, organizations are using the wearables. It allows the organizations to keep the patients in the community. That, as I already mentioned, organizations are very much keen and interested to keep the patients in the community. So that's why they are using, if you go to the website called Current Health, you can find out further details about this. Okay, they are having a cuff. It is just like when you are monitoring the blood pressure, you have to put up a cuff on your hand, and you measure your blood pressure. In a similar way, using this cuff, all these vital signs can be measured automatically, and the vital sign data can be sent to the nurses in the hospital at home care team, and then they can monitor the news to score on the mobile devices and say the news to score is green. So then the patient can be kept at home, and we don't need to worry about it. If the score is red, then immediately they understand that the patient is getting deteriorated. Then they have to immediately pulled and brought the patient into the hospital, and the appropriate care has to be provided. So that is one example of the wearables. And nowadays there is lots and lots of wearable devices are available. Even the Google Fitbit and a lot other devices are there to monitor the vital signs and to measure the blood pressure and to monitor the patient's condition. The next system which I want you to be aware is electronic prescribing and medicine administration systems. But before going into that, I want to mention about the electronic journey board. You might have seen in some of the hospital, when you visit a particular ward, in the ward, they might have a big whiteboard. In that whiteboard, they might have specified the list of patients in that ward and in which bed they are in and which doctor is providing the care to the patients. So far, for the at least 3 years before, in Australia and in UK, all this information is captured in the whiteboard manually using the black pen, as like okay, it's the classes have been conducted in the universities and also in the colleges. But nowadays the electronic journey board has been developed, and all the patient information is displayed into that journey board electronically, and the data will flow from various systems, and even the blood results, the blood samples which are raised and the blood results which are available for the clinician to view, and the pending blood results can also be viewed in the journey board. It is like a one stop shopper or one single source. If the clinicians can look at that journey board and find out all the information about the patient immediately and take a decision. And when they are going for a ward round, at the time also they can have a look at that journey board on their mobile devices like tablets or in a laptop, and then they can provide care. The next one which I'm mentioning about is electronic prescribing and medicine administration system, which enables the clinicians to prescribe the medicines electronically and enable the nurses to administer those medicines automatically at the time based on the need. And now the many more features have been introduced, like closed loop supply and closed loop medicine administration system. That means even you can scan the patient, scan the staff, and scan the medicine which is going to be given to the patient. Then if everything is correct and if everything is matching correctly, then the system will say, yeah, you are going to administer the right medicine as prescribed by the doctor. And once it is confirmed, then the nurses can administer that medicines or give that oral medicine or the medicines using any other routes to the patients. Then the prescribed medicines can also be validated and dispensed by the pharmacist, and at the time of discharging the patients, and the pharmacy people can validate and make sure that okay, these are all the the clinicians can decide these are all the patient and medicines the patients have to take it to the home when they are getting discharged, and those medicines are called as TTO, to take away. So then that medicine details will be sent to the general practitioners at the time of discharge, along with the electronic discharge notes. That electronic discharge notes will be sent to your own clinicians when the patient is getting discharged. This is one of the system. You can go and have a look at online. It is a better meds. So the system still enabled the clinicians to prescribe the medicine based on the patient conditions. Suppose if the junior doctor is not familiar exactly what medicine has to be prescribed, they can specify the indication. Okay, this person is having a diarrhea. As soon as they type diarrhea, then the medicines which can be prescribed to the diarrhea will be brought in. Then the junior doctor can review and then decide which medicine can be prescribed to the patients. So the main benefit of rolling out the electronic prescribing system is to improve patient safety by reducing or eliminating the prescribing errors and administrating errors which are arising from multiple sources because of the paper sourced prescribing. The next key information which I would like to talk is a patient portal. So that will give the healthcare vendors in India, or the people who want to become an entrepreneur and who want to do their own business, to think about it and to do some further analysis. Okay, what kind of portals are available in India, and what kind of portals can be introduced and implemented to meet the needs and demands of the Indian population. So you know it, okay, by the name. Patient portal means it is a one-stop portal for the patients. Okay, they can maintain all the information about their health care and records, health conditions. So if I go to Apollo, and if Apollo gives appointment, then if they can send that details to the patient portal, then I can go and either accept that appointment or ask for another appointment if I cannot attend that particular appointment. So I can raise a request over the online tool rather than visiting the hospital or going the hospital and requesting them to change the appointment or calling them. So then it will give much better experience to the patient, and it will simplify and reduce the time they spend with the healthcare organizations. In a similar way, my blood results and my ECG, X-rays, and all those informations can be stored in one common place. So when I go to another hospital, global hospital, okay, I have seen one consultant in Apollo, then after that, if I have to go to a global hospital and if I have to see another consultant in global, then again he is going to ask me to do a certain set of blood samples or a certain set of X-rays or CT scans. If I have done that blood samples or CT scans or X-rays within a certain period, let's say last 1 month or 2 months, then I don't need to do it again. The clinicians, if I give access of my records to that clinician, then clinician can and review that particular record and decide whether any additional testing is required. Then it helps to save a lot of money, not only to the patient, but it also reduces the time in getting the care to the patients. So messages, you can send a message to the clinician and the clinician can reply to that messages. So that it will help to improve the communication. Another good example, if I have to mention, it's all about repeat prescriptions. If I need a prescription, I don't need to go to the doctor. I can ask the doctor to prescribe that medicines again. Okay, in the countries like UK, if they prescribe medicines for a certain period, then they can have that medicines only for that certain period. After that, we cannot go to pharmacy stores, and we cannot ask them to issue that medications using that a prescription which was given 2 weeks back. So the clinician has to prescribe the medicines again. So it is a lot of effort. So that's why the re-prescription and facility which available in the patient portal enables them to automatically raise that re-prescription and send it to the patient. Then the patient can take it to the pharmacy stores, or still further an integration can be established with the pharmacy systems. You can send the prescription to the particular pharmacy store which is closer to your home, and ask them to send the medications to your home by reviewing that electronic prescriptions. So that will simplify the process, as people can pay for that medications online and you don't need to pay. It will make that patient's life easier, and it will provide better care to the patients. The next thing which I wanted to talk about is integrated care record. These are all the things which is already happening, so I wouldn't call it as an these are all the emerging trends in the developed countries. Okay, all this, whatever I'm talking, is already being used by the people to an extent. And some of the example on the patient portal is patient knows best is one company, and a doctor is another company. If you want, you can go and find out how those portals behave and function. The next one is integrated care record. It's all about sharing the records between various organizations. I already mentioned about patients giving access of their records to the clinician who is working in different hospital. In a similar way, if the patients are willing to share their records, and if the organizations are willing to integrate their records and share their patients' records with the other organizations, then that can be done using an integrated care record. So that means it will also enable the organizations to see the all set of records if that hospitals and organizations are interconnected, and it allows them to view their pathology results, radiology results, and pathology results, and their medical records. So you don't need to send the bigger images and the CT scan images, and or you don't need to take the pictures along with you. We know how difficult it is for us to store that images. So it's mainly to access the healthcare records from across the organizations, and also to provide the better quality care to the patients. So these are all the key things which have been already happening, but in India, okay, all these things has to happen over the period, and I'm sure at least within the next 10 years, definitely there will be a change in the way we all function, and a change in the way the healthcare industry will work. So in my view, okay, if you Google and if you find out, okay, about emerging trends in healthcare, people talk about, okay, telehealth, and people talk about robotics and robotic process automation. I'm glad that I haven't mentioned about robotic, because you already have a detailed lecture on robotic enabled healthcare. So robotic means, don't think, okay, you are it's mainly for robots enable us to provide the care, or enables the clinicians to provide the surgery. It's not only that, even getting an appointment, even the chatbot nowadays, whenever you visit any website, okay, automatically the chatbot appears, and chatbot ask you okay, whether you need any help. So it is trying to provide assistance. In a similar way, in the healthcare industry also, the robotic process automation will help the organization to simplify the way the process can be carried out, and the regular routine monotonous activities can be automated using the robotic process automation. And there are some tools called UiPath. It is one tool. Similarly, there are many tools in the industry, or otherwise you guys can also write your code using Python, or using scripts, or Java or JavaScript, and you can automate some of the processes. So the emerging trends in healthcare in the next 5 years, in my view, okay, the technology has been changing, and and it enables the organizations and enables the vendors to provide a better, safer care, and to prevent the diseases, and to diagnose the diseases in an advanced stage, and to provide a better care to the patients. So the technology enablement help the organizations to operate more efficiently, and to provide better, safer care to the patients. So some of the 5 trends in my view are artificial intelligence, without any say, because that is a buzzword nowadays. People are more keen to learn about AI and machine learning, and the deep learning, and natural language processing. I'm not going to talk about that. I'm going to mention about some of the use cases and some of the real world examples. And then Internet of Things and Internet of Medical Things, it is upcoming. And then virtual, augmented, and mixed reality. And then genomics, it helps the organizations to provide the personalized care and personalized medicine to the patients depending on the conditions. And the blockchain. So AI, it enables to prevent the diseases, or to diagnose based on the information which is available. So sometimes if the clinician is not having expertise in the particular area, if the clinician does not see those many cases, then it might not be possible for them to diagnose that particular condition immediately. So it will take longer time, or they have to discuss with their friends, or they have to speak to one of the specialist consultant, and before providing better care to the patient. So with the help of robots, so they can the vendors, the systems can feed in that information, because the AI systems are developed with the knowledge and with the information which are provided by various experts in the industry. So they can refer to the systems and to find out, okay, these are all the current scenarios and the conditions and what could be the possible outcomes. Then the system will provide that aid and assistance to the clinicians. It also improves the patient experience. It improves the outcome, and it augment the intelligence of the clinicians and eliminate the non-value added work. There is a demand for the radiologist, because there is a lot of workflow, and people have to review and assess lots and lots of CT scans and images, particularly during this COVID period, and they have to prepare the report. So with the help, thanks to AI and with the help of the AI tools, the system can assess and prioritize and triage, and then say, yeah, this one needs the doctor's attention, or say this patient, this report, okay, based on the information what I have, this the patient does not have COVID conditions, so doesn't need any further care, or this needs doctor's intervention. So then doctors can focus on that particular complicated and the CT scans, and then assess and provide the immediate right care to the patients. So that will help them to provide a better, safer care to the patients. So it helps to diagnose efficiently and reduce the clinical errors. And it's all about knowing the patients like never before. There are many tools, okay, many organizations, many startup companies. Even when we speak, by this time 2 or 3 companies might have started, and they might be working on the AI, or people are coming with having an idea, and they might be discussing, they might wanted to develop a solution and wanted to bring some value to the society, and also to make money using that solution. But some of the important artificial intelligence application which I wanted to share it with you is ADAC, which helps to diagnose the CT brain bleeds, and IDXDR, which helps to detect signs of diabetic retinopathy. I will talk about that in detail. And ICAD, it helps to diagnose breast density via mammography, and the contacts that help the radiologist in assessment and characterization of breast abnormalities. I already talked about the radiology abnormality assessment to an extent. Then neural analytics, it is a device for paramedic stroke diagnosis, is designed for measuring the cerebral blood flow velocities. So IDXDR, it is a AI diagnostic system that autonomously analyzes the excuse me, images of retina for signs of diabetic retinopathy, and they got FDA approval. And using a camera, a trained operator captures the image of the eye. Then the images are sent to the IDXDR system onto the local computer, and then it is being analyzed. And then it says that based on the image quality, it says whether the disease does not exist, or whether any follow-up care is required, or whether any further intervention is required. Yeah, okay, if it is negative, then the patient can be rescreened at a later date. If it is positive, then the patient will be referred to the eye specialist. Okay, there are some further emerging trends which is happening in the NHSI. The key thing which I wanted to share it with you, UK government has set up a NHS Artificial Intelligence Laboratory. which was mainly created to address the challenge the government is facing, and it is working along with the healthcare providers, academics, and technology companies, and to come up with the AI solutions to accelerate the testing and evaluation of technologies, and that meets the aim set out in the NHS long-term plan, and to provide a better care to the patients. In addition to that, UK government wanted UK to be a leading flag holder in the AI industry. So various proof of concept is happening in various hospital. One is Addenbrooke Hospital. They are working on the they are using a system called Microsoft's Inner Eye Systems, and another one is Moorfield Eye Hospital. They are using Google's DeepMind one, and they are mainly using in identifying a sight-threatening eye conditions. Then IoMT, it is also known as healthcare IoT. It is, as we all know, a connected infrastructure of medical devices, software application, and health systems and services that brings together people and enable us to deliver improved patient outcomes more efficiently. So it's you can, there are lots and lots of definitions. Okay, at a nutshell, it's all about collection of medical devices and application that connects to healthcare IT systems through online computer networks. Medical devices equipped with the Wi-Fi allow the machine-to-machine communication that is the basis of IoT. So this diagram explains how the devices are interconnected. So one example I can say is if the patient is having a difficulty in swallowing the medicines, then the doctor, the patient has to, and if the patient is having lots of medicines, then the patient has to visit the doctor more frequently. Then the doctor has to assess patient conditions. Then based on that, they have to re-prescribe that medicines. But with the help of IoT, so that the doctors can implant a device within the body, particularly chest, and then based on the medications they take and based on their conditions, and if they are having a problem in swallowing the medicines at a particular time, then immediately the device will send the voltage, and then it will give the disruption to the patients and send the data to the clinicians. So that enables the clinicians to do the analysis and to take a decision and to re-prescribe the medicines automatically. So that means the patient don't need to visit the hospital or the clinics by person. There are many IoT devices, fitness wearables. I already gave an example on the remote wearable devices and clinical grade wearables, and remote patient monitoring devices, smart pills, and point of care devices and Kishok. That means patient registration can be done using Kishok and then clinical monitors. So the key benefit of using IoT technology is improved drug management and the fast patient adoption, improved efficiency, improved diagnosis and treatment, and remote care can be provided. Another good example which I wanted to bring it to your attention on the IoMT is automated insulin and delivery system. The main reason I wanted to mention about this one is because in India most of the people have type 2 diabetes and they are all taking insulin. So what they have to do is they have to monitor their blood glucose level. Then based on that, they have to work out and calculate the insulin, and they have to take that insulin at the right time. So but using this automated insulin and delivery system, you don't need to worry about it. You need this device. If I remember correctly, I think the device cost around $7,000 to $8,000, and it has been improving. And aid systems can be now controlled even remotely via smartphone and send data to the consultants also. So I think this functionality will become a reality in this year. So but you have to by implanting this device, the device will continuously monitor the blood glucose sugar level to determine how much insulin is needed and deliver the continuous flow of insulin into their body via the insulin pump. person with a diabetes to take a finger prick test. Okay, they don't need to take the finger prick test. So it is also known as closed loop insulin delivery system or artificial pancreas system. Okay, next one is virtual reality. I'm glad that it is already being used in India. So it mainly helps hospitals to train students, because you know how difficult it will be to learn anatomy. So but with the introduction of virtual reality, people can visualize it and learn and the functionality of the body, and they can learn it very much more efficiently. Then people don't need to memorize all those things. Then they can visualize it, they can understand how the each body systems will work, and they can easily pick it up. So it can be used for training or during the surgery simulation. It can be used to provide and training to the junior doctors. You don't need to worry about killing the patients, or they can get that extra treatment by working on the dummy patients, and they can become an expert. So it also provide assistance to the patients in the number of ways, such as particularly with the patients who are in depression, cancer, autism. I will share a video in a minute that will help you to understand and to know firsthand about the way the VR is being used in the industry. I think it is mainly used in AIIMS and in some other bigger hospitals in India. It is mainly used in the stroke rehab, spinal cord injury, cerebral palsy, autism, cancer, and vision disorders. Give me a minute.
Sir? Sir?
Yeah.
Sir, the video is not playing, sir.
Oh, okay. I will share the link later. Then you can.
Maybe kindly play the video now, sir.
Sorry, can you just a minute? Give me a minute.
Sure, sir. Okay, sir.
Play option.
Okay, I will play it at the end. Okay, I thought I have shared only the presentation, not the video. Sorry about that.
Okay, sir.
Okay, the next key technology which we have to have an eye is blockchain. We all know the key issues in healthcare data management. So we okay, because we are different types of data structure. Okay, unstructured data set and semi-structured data set and the structured data set, and the data format, it's not digitized in healthcare. Still we are using papers, and data complexity for the same conditions. Let's say maternity. In a maternity, the different hospitals capture the different set of information, and the data is being captured in a different locations. So blockchain is a natural solution to this roadblock of siloed data in the healthcare. So it's mainly a distributed system recording and storing transaction records. It's a shared immutable record of peer-to-peer transaction built from linked transaction blocks and stored in a digital ledger. It relies on establishing cryptographic techniques to allow each participant in a network to interact. So another startup company called Data Structure, it's a EHR management solution that simplifies interoperability within the healthcare. So that means the record can be, a patient can decide which record can be shared with whom. You might recollect, I already mentioned that patient can share their records to the clinicians using the patient portal. So blockchain can play the role within the patient portal, and then it will control, and it will also enable the patient to see who has to view and who shouldn't view, and what sort of view has to be given to what sort of clinicians. So for the research, they can also participate in the research and in the clinical trials, and they can try to make money, or they can share their data with the consultant, or they can share their data with the surgeons, and then make it get their relevant care. Another system is called a genome. So that also allows the patients to share the data either for research, clinical trial, or for pharmaceutical companies or with the government. Then the next two things which I want to bring to your attention is Block Verify. It is an UK startup. It mainly focusing on anti-counterfeit solutions that simplify verification of drugs authenticity down to your barcode scanning. So that will help to reduce the errors which happen, or fraudulent activities which happen in the supply chain. In a similar way, in USA, there is another company called iSolve. They developed advanced digital ledger technology, and it also mainly work within the drug supply chain. It also prevents counterfeit drugs from which are being sent via the supply chain. So it may ensure that prompt communication happens between the drug supply chain partners, and it also improves the inventory control and management. The last one is genomics. It is the study of body of genes, their functions, and their influence on the growth, development and working of the body, and using variety of techniques to look at the body's DNA and associated components. And NHS has initiated 100,000 100K genomes project to harness the power of genomic technology and science to improve the health of our population and deliver the commitments in the NHS long-term plan. The main benefit which I believe will come out of this further R&D which will happen in the genomic industry is personalized care by analyzing the genes and the DNA, the clinicians can decide, okay, what kind of particular within the cancer, what kind of particular cancer the patient might have, and what kind of okay, treatment and the medications has to be given. Okay, based on the DNA, the doctors can decide what sort of medications can be given to the patients. So and this is one of the interesting ones to have an eye in the long term. So as a patient, what we all want to know. So I want a better, safer care, and I want a personalized care, and I want the right care at that time. So it's all about me. So whatever we do and wherever we go as a human being, we all try to put ourselves first. So that applies within the healthcare industry also. So it is important for the healthcare vendors and the healthcare providers to understand that need and understand the demand and the expectation from the patient, and behave accordingly. That means they have to adopt technology, but only having the technology will not help them to provide the better care. So as I mentioned at the very beginning, it's also very much important to introduce the right change management process. So that means organization has to think about having the right leadership when introducing this digital transformation program, and they have to ensure that the right set of stakeholders are in place, and the organization is having the right culture. Okay, even if you have the right leadership and if you have the right stakeholders to implement the project, if you don't have the right culture within the organizations, if your clinicians are not willing to adopt, and if your team is not willing to deploy at a faster speed in an agile manner, then the organization might not realize the benefits which they wanted to realize. In addition to that, it is important to have the right set of skills and the talents. And the last but not least, the organization have to think about the data security, and the data is being maintained in a secure manner, and it will not be hacked by the people, hackers. So they have to give the assurance to the patients that their data is being maintained in a safer and secure manner. So it is the organization's management responsibility to ensure that they are yeah, onboarding the right set of leaders with the right set of skills, and enabling it happen. Then only the technology can make the change within the organization, and it will help them to enhance the experience to the patients. Thank you. Thanks for giving the opportunity to give a presentation. Sorry, it looks like that I have taken some more time than originally planned. It's also because of the delay which has happened at the very beginning. Thank you. I will go back and try to play the video. Give me a sec. I hope you can see my screen. Please let me know. Can you see this video now?
Yes, sir. It's clear now.
Audio.
Sir, the video is playing, but there's no audio, sir.
Yes. Okay. I will give you the URL link. You can go and have a look at it.
Okay, sir.
Okay, I think that's it. That's the end of the video. Thank you. Thanks once again for listening patiently, and thanks for giving the opportunity to everyone.
Thank you
Thanks,
so
Shema.
much, sir. It was really a wonderful and informative session, sir. A lot of new information was shared. Thanks a lot, sir.
Thank you.
Dear participants, if you have any questions, you can post it in the chat box or you can unmute yourself and ask, sir.
Yeah, thank you, Lakshmi. Sir, I am Dr. Vijayendra Babu, Vice Principal, Professor, EC Department.
Hi, Dr. Vijayendra.
Hello, sir. Hello, sir. I enjoyed your session, sir. I was very keen on interesting on today's sessions, both on healthcare management. So one about robotics-enabled healthcare, surgery and healthcare. And your session is on emerging trends in healthcare, digital transformation. It's a very buzzy word. What is a wow word? I can say like an eureka word. It's the need of the hour because in the pandemic situation, everybody talks about healthcare. What about the future? How we should take it care? And what are the technologies getting included and inclusivity comes there. It's the need of the hour. So you touched upon various factors. It's wonderful. As you were taken as a virtual tour, I can say about the basic aspects of all those digital transformation. Let it be starting from a telemedicine or big data or IoT like VR, AR, and about the Alexa, the wearable devices and the supporting devices. And it's about the patient-doctor communication. It all includes about all those things, getting closer to the patients. And also you covered about the sources, the significant value like reimagining the process and all, and getting closer to customers and building intelligent products, and also taking care about the risk factors too. And it was a complete study, which I should take it as a wonderful session. We all enjoyed. Thanks for your presence, sir. We expect few more collaborations and mutual developments from both sides of us. Thanks for your presence, sir. We enjoyed it.
No, thank you, Dr. Vijayendra Babu. I would like to thank organization is conducting then this kind of sessions that gives the opportunity for the students to learn and to get some insight on what is happening across the globe. So that is the key thing. I saw various other keynote speakers from across the globe also, and that will give the opportunity to the younger generation to think about becoming an entrepreneur rather than just joining the bigger companies and getting into the job, because at this early stage they can take that risk and then they can try to make a difference, not only to them, to the society and to the to the country. So that is the key thing.
So wonderful takeaway. Say always insist to student. Learning is more than earning in initial stages. It is a wonderful opportunity to take risk. We can say it's a factor called risk, but it also gives a boost also for any stages. Thank
And
you,
also,
sir. Thank you.
government has introduced a lot more opportunities. I'm sure. The central government. I'm not sure. How many people are aware about it? Because digital startup. If you go and Google, you can find it out, and they are announcing lots and lots of funding opportunities and creating a forum where students can go and submit their ideas and participate in that competition and try to they are encouraging the organizations to create that culture, and they want more entrepreneurs to come from India. I hope within the healthcare industry also a lot more new entrepreneurs come, and that will also be from your university also at some point.
Well said, sir. Well said. Thank you. Thank you.
Thank you, Raj, for giving a wonderful session, a descriptive and elaborate session, I have to say. So you have touched each and every part of digital transformation in healthcare. So the students will be gained the more insights about the digital transformation in healthcare. And as Professor Dr. Vijendra Babu sir mentioned, we'll have some collaborations with you, UK-based healthcare systems, so that the students can get some real-time experiences in the industry, in the healthcare industry in UK. So we'll collaborate in future, and that is a milestone in ABIT's research activities.
Thanks, Hema. Thanks for
Thank you.
inviting me, and thanks for giving the opportunity. Yeah.
Thank you so much. Thank you.
Sir, a small token of appreciation from our side, sir.
Okay,
Please
thank you.
accept it. Thank you, sir. Thank you.
Yeah. If there are any questions, I'm happy to answer before I leave.
Participants, if you have any question, you can post it in the chat box, or you can unmute and ask, sir.
Actually, we were discussing about the Atmanirbhar, the digital startups.
Okay.
Bowser, we were discussing, and we'll see how we can bring into our Ganeshan incubation also.
Yeah, sure.
For this
Yeah.
digital healthcare. Yes.
And also
And,
many research can be carried out within the healthcare sector. That is another interesting topic. Actually, I didn't have much time to mention about that articles, as we are already getting late. I didn't want to hang on further, but there are many articles and review has happened, particularly on the digital healthcare emerging healthcare trends, and so people can think about those area and how the research can be carried out. So my research topic is also adoption of clinical information systems by private medical practitioners. Okay, thank you.
Thank you. Thank you.
Thank you, sir.
Thanks, everyone. Thank you. Have a nice day. Bye.
Thank you. Bye.
Dear participants, there are a few announcements to be made. The first one is the feedback link for both the sessions, that is Nandakumar sir and please do fill both the feedback links. And the